All right, chapter 20, Immunologic Emergencies. So we often get called to people that are having allergic reactions just because a lot of people don't really know what to do if they don't have major allergies. And an allergy can truly develop at any time. It's not from the first exposure, it's from subsequent exposures. Um, so a lot of allergy related emergencies may be fairly simple. They've got some hives, they've got some itching, but we can go all the way up to acute airway obstruction and cardiovascular collapse. And those that tend to go that direction go down very quickly. So we need to be able to treat the life-threatening complications and then be able to determine, is this a usual response for this person or is this truly an allergic reaction? The immunology portion of this, which is the study of the body's immune system, and then we'll go through the 5 categories of stimuli that end up provoking an allergic reaction. So the immune system protects the body from foreign substances and organisms. When something comes into the body that's not recognized, the body starts to react. It becomes sensitive to whatever that substance is. And then there's several different responses to try and mitigate that invader so that it can't cause disease or further harm. An allergic reaction is just that body going into hyperdrive, going way further into trying to protect the body than what's necessary. The it's not necessarily caused by that thing that gets into the body. It's more the body's immune system overreacting to it. So your body will start releasing a bunch of chemicals to try and get rid of that stimulus so that it can't hurt you. But there's things that can get into the body that the immune system doesn't recognize, doesn't realize, doesn't try to attack. And that can sometimes lead to severe problems as well. So it's kind of like depends on what the body wants to do with it. Couple of the chemicals that get released, histamines and leukotrienes, they pretty much drive that allergic reaction. And truthfully, any given thing at any given time can cause an allergic reaction if given to the right person. So the first time that they're exposed, they become sensitized to that substance, meaning that the next time their body runs into it, it's like, yeah, hey, I remember this. I can attack this a lot faster because I already know what it is. Then after that, the subsequent exposures, your body ends up ramping up a lot faster and a lot more aggressively, and sometimes it just goes too far. Some patients know exactly what causes their reaction, and it's super easy just to quick treat them because they already know what's going on. Other people have absolutely no idea. So we need to understand what the signs and symptoms are and then maintain a high index of suspicion. And it's not just, okay, well, this person is probably outside and could have been stung by a bee. And no, I mean, it's just they can literally be allergic to anything at any time almost. When it goes far too far in its response, you end up with what's called anaphylaxis, which is a very life-threatening allergic reaction. It involves multiple symptoms. In severe cases, it actually can progress to shock and death very, very, very quickly. It's often kind of scary how the patient can go from talking to you to you're worried about them being alive by the time you get to the hospital very, very, very quickly. And you can see in the picture representation what tends to happen with each system that are the main drivers of anaphylaxis. I'm sure that's in your book as well. 3 common signs of anaphylaxis are urticaria, which are hives. So that's what the top picture is, small areas where you have generalized itching and burning that may appear as several raised bumps on the skin. Angioedema, which is just areas of swelling. The picture on the bottom, that lady's tongue has swelled up to like 10 times its size, and that causes massive airway obstruction. And then wheezing, because your bronchioles constrict, they end up swelling as well, and they spasm. So you get that high pitched kind of whistly sound that's heard on expiration. Not only is it produced because of the bronchospasm, but you also start producing a lot of mucus at the same time. And if your tongue is that swollen, trying to get that mucus out is going to be pretty rough. Patients may also have hypertension because their body's going to vasodilate and increase capillary permeability. In a normal reaction, that's necessary for your blood to transport white blood cells and things that are associated with the immune system to that area to actually take care of whatever attacker that is. Well, the problem with anaphylaxis is it's overshot, and so you end up having a really hard time maintaining a blood pressure. You get a lot of swelling in relative areas that you shouldn't have swelling in. And then one symptom that's often overlooked in a patient that's experiencing an allergic reaction is gastrointestinal dysfunction. So nausea, vomiting, abdominal cramps. Your body tries to do whatever it can to get that substance out. So it's like, well, if by chance it's somewhere in the GI tract, then if I force everything to come out of the GI tract, usually from vomiting, because that's a lot faster than trying to get it to go through all of your intestines, but then I might be able to protect myself better. Some common allergies fall into 5 general categories. Food, especially shellfish and peanuts, are the most common trigger of anaphylaxis. The shellfish, peanuts, really just tree nuts, account for 30% of deaths from anaphylaxis, and most commonly that's going to be in adolescents and young adults. Symptoms may take more than 30 minutes to appear, so it might take a while for you to see what's going on, and they might not be able to tie that back to what they've actually eaten. It may not include skin signs such as the hives, and it may just start immediately attacking the respiratory and cardiovascular system. Medications kind of depends on how we get those medications into the body. Medications are the second most common source of anaphylaxis, and particularly the ones that are going to cause really severe reactions are going to be those injected medications. So penicillin is one. Morphine tends to be another one, and not necessarily the morphine, but the sulfa group that's attached to it. Some people are allergic to NSAIDs, which are nonsteroidal anti-inflammatory drugs. So that's your ibuprofen. If the medication is injected, that's going to be relatively immediate for the body to respond, so within 30 minutes, and is more severe. Oral medications take more than 30 minutes to appear. They can be very severe, but for the most part, they're not generally as bad as those injectables. Plants, a lot of people have allergies to dust, pollen, and then just other plant materials that can cause a rapid severe allergic reaction. Common plant allergens include ragweed, ryegrass, maple, and oak. And this isn't like seasonal allergies. You know, all of us can have some seasonal allergies without anything driving us to anaphylaxis. This is a true hypersensitivity. Chemicals. So we have chemicals in everything that we put on our bodies, that we digest, that we whatever, like makeup, soap, hair dye, latex. Um, Latex itself is a big health concern for us as healthcare providers, but then also for our patients because we wear gloves when we interact with our patients. And if they or us have a latex allergy, that can be pretty rough. That actually leads to a lot of issues with providers. About 12% of providers um, end up becoming sensitive to latex. So we end up using nitrile gloves instead. And then insect bites and stings or envenomation um, with an insect, this is actually injecting its venom into the body itself. So relatively similar to injectable medications, because a lot of those we're going to, especially like penicillin, you inject into a muscle and it has to absorb. Same thing here. You can get something as simple as a localized reaction where it causes swelling and itching just where that happened, or it may progress to anaphylaxis. Approximately 3% of adults and 1% of children are allergic to the venom that bees produce. Allergic reaction to insect stings account for about 50% of the deaths in the United States. The stinging organ of the insect comes from the stinger, obviously, which is just that small hollow spine that projects out from their abdomen, which has that venom sac attached to it. And just keep in mind, not everybody knows they have an allergy to bees. I mean, you would think it would just make sense, but about half of the deaths that occur, the person had no idea that they were allergic to bees. So, honeybees cannot withdraw their stinger when they end up stinging somebody. So they sting, and that stinger ends up sticking to you because they can't pull it out themselves, and then they fly off and do their thing. Once they fly off, they end up dying because part of their body is now missing. So you end up having to remove the stinger, and it can continue to inject venom into your patient for up to 20 minutes after that initial contact. And because they often fly away and it's hard to identify what's going on, you might not know which particular species or what particular insect is the cause of that bite. For wasps and hornets, they can sting multiple times. And once they do sting, fun fact, they release a pheromone that attracts other wasps and hornets to that area as kind of an attack call or an attack signal so that more people will come in and help them fight off whatever the issue is. And they don't die after stinging. They can continue to go and go and go until you stop them. There are some ants, especially fire ants. They will bite repeatedly, and then their toxin is particularly irritating. You can see the little pustules on his foot. A lot of times it's going to be sudden pain, swelling, localized heat, widespread urticaria, redness in light-skinned individuals, itching, and possibly a wheal that is raised on the skin. And it can be pretty darn painful, truthfully. Applying ice sometimes makes the bites and stings less irritating. However, not a huge idea right away. We'll continue in the next one.